On November 20th, 1919, in Manhattan, New York, a pioneer of cancer research and development of chemotherapy was born, someone who would change both the scientific and secular world. This someone was Dr. Jane Cook Wright. From birth, the bar was set high for Jane and her two sisters because her father was one of the first African American graduates from Harvard Medical School, the first black surgeon at a non segregated hospital, NAACP chairman, and also founded the Harlem Hospital Cancer Research Center in 1945, at which Dr. Wright would do most of her groundbreaking work. Cook attended Smith College, a liberal arts school, for undergrad, where she majored in pre-med, biochemistry, and biology. She then, like her father, attended medical school at New York Medical College, where she graduated with honors in 1945. Dr. Jane Wright's most impressive contribution to science was her research she did in cancer and development of chemotherapy. She started her research in 1949 at Harlem Hospital Cancer Research Center with her father. The time in which Dr. Jane Wright lived, chemotherapy was extremely experimental and was used as a last resort, but Wright saw the potential in it. So she and her father began to look for anti-cancer chemicals, and in 1949 they started testing chemicals for new effective properties to slow or stop leukemia and other cancers in humans. Dr. Lewis Wright would work in the lab, and Dr. Jane Wright would perform the patient trials. Several patients who participated in the trials had some remission. They would find more success in early 1951, where their work led to establishing methotrexate as an effective drug and chemical to treat breast cancer and tumors. But following Dr. Lewis Wright's death in 1952, Dr. Jane Wright was appointed head of the Cancer Research Foundation at the age of 33. To honor her father, she started American Society of Clinical Oncology, or ASCO, which she pursued goals similar to her dad's, which are to set a standard and example for clinical oncology, thus improving knowledge and research experience. Dr. Jane Wright would have more accomplishments along her pivotal 40-year career, such as in 1967, Dr. Jane Wright was appointed Associate Dean and Professor of Surgery at New York Medical College, where she established many cancer treatment programs. She authored more than 135 scientific papers while being a mother of two daughters. Additionally, she was appointed to the President's Commission on Heart Disease, Cancer, and Stroke, where she established treatment centers nationwide and even led delegations of researchers worldwide to help other countries. Also, in 1971, Dr. Jane Wright was the first woman to be elected president of the New York Cancer Society. Like her father before, she also became a civil rights activist and fought for equal rights and treatments of both African Americans and women. She believed that everyone could achieve greatness when pushed to do so. Dr. Jane Wright would then pass away on February 19, 2013, in Guttenberg, New Jersey, leaving behind a trail of excellence and greatness. Dr. Jane Wright is an inspiration to me in so many ways. From her life-changing research in chemotherapy that has personally helped my family immensely, to her being one of the three sisters to follow in her father's footsteps to attend medical school, just as I intend to do. She persevered through countless obstacles, and I believe we can all learn from this determination and heart of Jane Cook.